Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Ilona Rodan, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Hi, this is Dr. Susan Little.
And Dr. Kelly St. Denis, and this is the Purr
Podcast.
In synchrony.
You know, I think we need a theme song.
Yeah, we're gonna have to work on one.
Yeah. We have theme music for the podcast. We don't have a song.
That's right. Maybe that's something we need to do.
I think that's something we need to do, yes. So if you're wondering where's Yola, well, we're wondering too.
Where is Yola?
Where is Yola? We think he's in Asia somewhere. And so our regular guest co-host has teamed up with me for the first time.
Yay.
And we've been let loose on the pod. We've taken over the podcast.
Yes.
Yeah, we're not sure we're going to give it back, actually. And I like to point out we are at the American Association of Feline Practitioners Conference, which is in Minneapolis. There's a lot of feline people and feline specialists here. And these are the first times we've had 3 feline specialists take over the podcast.
Yes.
Right? Like,
we rule.
what other podcast has 3 feline specialists on it?
Right, exactly.
Yeah, and we're so lucky because we have the best of the best. So this is our second episode with Dr. Ilona Rodan, who so many of us look up to, who so many of us look to you to help us work better with cats. And I hope you know how big your influence is. I hope
thank you. I'm honored to hear this. I mean,
so Kelly,
I'm not alone.
Kelly and I were talking earlier about how sometimes it's hard to see the influence that you have, right? Sometimes it gets a bit discouraging. So I try to remember to tell people who have influenced me that yes, you do make a difference.
Well, likewise to both of you.
You do make a difference.
And the first time I met Ilona, I think I accosted you at a conference at breakfast just because I was like so in awe of her, all the things I had already learned. And I think that was in like 2011.
Oh my God.
Oh, yeah. After the first guidelines, the first handling guidelines, which now are interactions guidelines.
Yeah. Actually, that's so we do want to talk about like intercat tensions, but you brought up a good topic, and that's that AAFP has a lot of free guidelines and client-facing materials on their website, catvets.com. And there's way more about cats in the hospital and cat vet interactions, and that is amazing.
It is amazing.
It is
time.
Right?
Cats rule, and they need it.
Yeah, as you say, you started from just simple handling guidelines, and now look where we are. There's a series now, right?
Yes.
Yep.
I think this new cat-friendly veterinary interactions guidelines, there are 153 references.
Oh.
The first guidelines, I think there might have been around 40, 50.
Isn't that something?
So, yeah.
Big difference.
Big difference.
Yeah. So, that's just amazing. In between there, we had the nursing guidelines, remember, too.
Yes.
And that, I thought, was a really nice companion. I thought we're going in the right direction, right? And now, of course, we are, because we've got these guidelines that talk much more about the interaction. I like that.
And the environment, which is so important.
Yeah, I like that. And I think we still struggle a little bit to convince some vets to make changes. Do you feel like that? Like some vets still struggle a bit?
Yes, it's really hard to make changes, and I think, I started with just making the changes myself, and then people could see the changes I was making, but people were like, oh, you want me to be injured? And I'm like, no, I don't want you to be injured. Right now, we have too many workers' compensation claims, and you're getting injured, and I hate to see you injured. Mm-hmm. This is all about not getting injured and taking care of the welfare of the cat.
Yeah. That's a good point. I think just as some cats have memories of bad interactions with people. Some people have memories of bad interactions with cats, don't
Right.
they?
Yes, absolutely.
Yeah. So, like, all three of us have been practice owners, and we know that we have to look for team members who are not afraid of cats, right? Team
Yes.
members that have a positive interaction with cats. And I think that's also like a good piece of advice when you're looking to hire employees, right? One of the things that you could consider,
Yeah.
right? Even if you're a dog and cat practice, is do we have enough cat people? Because I think even in those practices that are sort of bigger in their general practices, there's probably one or two cat people in the group.
I agree. And I think what's really helpful now is having each person get their cat-friendly veterinary certificate. So there's certificates for veterinarians, veterinary professionals, the technicians. Students can do it.
Yes.
Anybody at the university, well, veterinary hospital can do it.
Yeah.
And so it's really good, but it's also the veterinary assistants and the CSRs, the client service representatives, so it's buy-in by everybody.
Yes.
And now it's not you or me
Right.
telling people what
Right.
is the best way to do it. It's somebody else.
Right.
It's all the science that is behind that, and that makes such a big difference.
So tell us a little bit about each of those certificates, because I think they need more press, right? Like
They
it's
do.
such a great program,
Yeah.
right? But we need to tell people more about it, because I think it kind of flies under the radar.
It flies under the radar, and I think people may know more about cat-friendly practice, but a lot of people say, well, I can't get a cat-friendly practice. Well, if you start with cat-friendly certificate programs for everybody else, and this reduces the amount of training that's done. Any new member that comes to the practice just goes through the cat-friendly veterinary certificate program to help them feel more comfortable with cats and do a much better job with cats. And this is all through the AFP, which is now the Feline Veterinary Medical Association.
Yes, it's breaking news.
Breaking news.
As of this week.
Yes.
Yeah.
Yes, and it's great because that means this includes technicians, veterinary assistants, anybody else, and it's not just the Americas. This is worldwide.
And there's a couple of different certificates, right?
There are.
There's a vet one.
The veterinary one is for veterinary students, and veterinarians.
Okay.
Right. And then the cat-friendly veterinary professional is for technicians.
Okay.
And each module is a different number of modules, each certificate.
Yeah.
And then the other one is for veterinary assistants, the advocate.
The advocate, yes.
Yes.
Okay.
And
Yeah.
that's and the client service representatives and practice managers
So there's something for
and
everybody.
kennel people. It's for everybody.
Yeah.
So, and it's not expensive.
No.
This is not an expensive investment for a practice.
And it's all done online.
It's
right?
all done online. The 9 modules for veterinarians took me maybe 4 hours. I don't think I was doing it all at one time. I'm thinking it's about 4
I
hours.
don't know some of the answers to the questions because you
Maybe.
wrote them, but
You and me.
Yeah. Same. It didn't take me very long, but they were very detailed, and very helpful. But yes, the modules
Right.
Oh, I
don't
love
take
that.
very long. It's
Yeah.
not a huge time commitment, and you do get CE hours from them too. Like
Oh,
they
yeah,
each
that's a
have
good
their
point. You get
individual-
CE credits.
Yes, yes.
Yeah.
The veterinarian one is longer, so it's more CE hours.
Yeah. Yeah, so I think that's something that deserves a little bit more of recognition,
Absolutely.
right?
Absolutely.
Yeah. I think it also kind of demonstrates to your team that you really take it seriously,
Yes.
right?
Yes.
And it gets
Even-
back to the thing, like you were saying about how you did things a certain way, and then people saw you and decided that's really working well for her. I'm going to do it too. So if you have a cat-friendly veterinary certificate, other people are seeing you act in a cat-friendly way. Other people will buy in the practice.
Yeah, you're right. Modeling a behavior, I think, is often more impactful than trying to force a behavior, right?
It has to happen that way.
Right?
Right. Right. It really does. But I have to say, when I did it, change took longer. With a cat-friendly certificate program, it's much faster.
Yeah.
The buy-in's much faster.
Yeah.
I think it is, at least in a segment of veterinary hospitals, it's faster just because awareness of cat-friendly practice. Even if they don't do it, a lot of them know what it is.
Yes.
Right? So the awareness level that cats need different treatment, I think there's a better awareness level.
Yes.
Right?
I agree.
Out there.
Totally.
Yeah, and we just need to make sure that people know what the tools are, and that there is a lot of help, because I think, and I'm as guilty of this as anybody. We bring a new team member on, and you have good intentions.
Yes, you do, but you're busy.
Of teaching them this, that, and the other thing. But before you know it, time has gone by, and you haven't found time. And so that the certificate course can help with that. And the other thing I like about this certificate course is that your team member is actively doing something to improve their feline skills, rather than being the passive participant.
Yes.
In the me to you.
Yeah.
Not that there's anything wrong with that, but I like the dynamic that now it is an active participation.
I totally agree.
Right?
The active part is really good. It empowers people to feel like, I can do this.
Yeah.
This is really, this is my certificate. I did this. I'm now part of this team
Yep.
Yeah.
to help cats.
And I think we kind of, so like you guys, I've been a practice owner a long time, and I'm still kind of learning how to be a practice owner, because like nobody taught me.
No.
Number one,
No one.
That stuff.
nobody taught me. And, you learn things all the time, but like trying to shift learning experiences, especially from, passive to active, I think is just one of those little, it's a human behavior thing.
Yeah.
Yes,
Right.
it is.
We
need to change behavior of humans. Yeah.
And isn't that what this is all about?
Yes, it is.
It's changing the behavior of people. So you've been doing this a long time. What are now the most common kind of pushbacks that you get? Like what do vets or technicians come up to you and say, yeah, but like, what do you
I think
is
it's
still a
mainly
problem?
the team. So today I talked with technicians, and they'll say, well, the veterinarians don't want to do this, or the other members of the team that have been there longer than me, they don't want to make these changes. And I think that's where human change is hard, and people are busy, and that's why I highly recommend the certificate program. But it's little by little that they have to make those changes. And I tell people the first thing in practice to get is hiding beds. Just having those beds and towels to loosely hold cats makes such a difference. They feel so much safer. The cats are feel protected, and they don't feel like they have to protect themselves in a different way so much.
Yeah.
Yeah.
So amazing.
Yeah,
How
you
much
give them like little signals, I think, that your intent is good, right? If the towel is warm, that's a signal that we probably
Yes.
don't have evil intent. If you can hide, it's probably a good sign, right?
Yes.
I think we're trying to give them like little signals.
Yeah.
Even
Exactly.
though this is a scary place, right? We're trying to counteract that with like warm towels. So I have to tell you a funny story. So my dentist, who I really enjoy. So we're both small business owners, so we kind of connect on that plane. And one day earlier this year, I was in to have some work done on a tooth, and so I'm in the chair, and then they lay you back, and they're getting everything ready, and suddenly her assistant comes with a warm towel.
Oh, yes.
And kind of swaddles my head, right? And my dentist comes in and says, we were just at a conference, and
Was it sprayed with Fellaway?
Yeah.
no, fell away. And I'm laying there listening. I'm thinking, oh my gosh, right? So she's saying all the same things, and so like, how does it feel? And I said, I have to tell you a funny story. Guess what cat vets do?
Yes.
I
Yeah.
think that sounds really nice, but actually, I want the whole blanket. Like you get in the hospital.
I get that at my dentist, the warm blanket. I'm like,
I want the whole
I can't
thing.
wait.
I did at an endodontist I went to. The blanket. See, it's not just vets.
No, absolutely.
Yeah.
And you end on a positive note. They give you treats when you leave.
Yeah.
I mean, they even
Yeah.
give us cookies and if you have a lot of dental work done, they'll give you a loaf of bread that was homemade.
Oh my
So
gosh!
yeah.
Talk about positive reinforcement.
I know. I'm like, I'm coming back to this dentist.
Your dentist.
But you know what? We have to positively reinforce the owner and the cat,
Absolutely.
right?
Right.
So that begs a good question. And so I'm going to ask you this first, Kelly. How do we reward the client?
How do we reward
I know, like you
people?
need to think about that though, right?
Yeah, I mean, I think when I'm interacting with clients, I think some of the reward they get is from the way I engage them in the whole process.
Yeah.
So rather than having them stand off or sit down and I have a team member, and I always like to caution this because I live in Canada, so we can have caregivers interact and help offer
Oh, that's
food.
true.
But in the U.S., you're a little
It's
bit
a
more.
liability
It's a liability
issue.
if the owner gets bit or something, right? But I really engage the caregivers in what's going on. So if the cat's liking a treat, I will say, okay, here's your job. Here's the churu. You can feed the cat. I'm going to give the needles. And they're involved. And they always say to me, this is so amazing because I got to see it and I really like what you did with my cat. And they really, I think, get something out of being involved in it. And the same thing with the blood draws. I always employ them to be at the front of the cat, petting the cat, feeding the cat, whatever the cat wants, right? And I think I find that very rewarding for people.
Oh, that's a great answer, isn't it?
It is a great answer. And we do it in the United States, but I have to say it depends on the caregiver
Yeah.
and it depends on the cat.
Sure.
And then, but usually I'll have them be feeding the churro. And I just tell them to hold on to the other end that's away from the mouth and try to come from the side so they're not just
Yeah.
Yeah.
looming over the cat.
There's a way to
Just-
do it.
Yeah. And sometimes I'll talk to them about the the glands that produce the facial pheromones, and just have them massage from the side or behind over, between the ears and the eyes, or the cheeks, or the chin,
Yeah.
in a way that will not allow them to get bitten by the cat.
Right.
And,
Yes, that's
but you
good.
have to know your cat and the caregiver.
Yeah.
So yes.
Yeah. I think it's great though if you can give them a job in the process.
Yes.
Right.
Yes.
I always
So
send
they're
a
part
toy
of
home
the
with
team.
cat. So
Yes.
it's just
We
really
do-
for the caregiver. It's not
Yes,
really
it's
for the cat.
Yes, we
know.
do that too, or we send home some more churu.
Yeah.
And
Yeah.
if catnip is okay and it won't arouse the cat, we may do catnip as well. But the other thing, I think, in addition, which we do and we don't think about, is we always tell them what a great job they did.
I was just going to
Yeah.
say
Yeah.
that.
Thank you. Yeah.
I mean, look
Yeah.
how their cat has
Yeah.
received
Yeah.
such great quality of life
Yeah.
and such great veterinary care because of those people.
Yeah.
That's a good
Yeah.
point. I like that.
Yeah, that's about ending it on a high note. Yeah,
Yeah.
I do like to end it on, you're doing a great job. Like,
Yeah,
your
I mean-
cat's doing great. You're a great cat owner.
Right, even if it's end of life and they're like, look what you did for your cat
Yeah.
and look at the bond you had with them.
Yeah,
You know, they had such a great quality of life with you
Yeah.
yeah.
and you made the right decision at the right
Yeah.
time when it was needed.
I think that is part of being supportive of the owner, isn't it? Like trying
Yes.
to make sure you're supportive of the owner, and especially in feline medicine where. Maybe this happens in the other species too, but there's lots of ways for it to go wrong, right? In the
Yeah.
exam room, especially if a team isn't very skilled with cats. There's ways it can go wrong, and so to look for the opportunities to reward. Maybe it's your tech who's just learning to be in the exam room with you, right? So learning. So I learned this from. We have a communications manager for our practices, which, by the way, is the best thing we've ever done, was hire Stacy. And Stacy talks about the sandwich when you're talking to people. Start with a compliment, and if you've got some constructive criticism or change, that goes in the middle, and then you end with a compliment.
Yes.
Right? And you don't want to like make up compliments. You got to try to find a problem.
Yeah, absolutely.
And that has stuck with me because people tend to remember how they were greeted, like how did it start, and then they remember how it ended.
Yes.
Right?
And I think also, instead of saying, don't do it that way, it's easier if you do it this way, or cats will like it better if you do it this way.
Yeah.
So it's not, you've changed the negative to more of a positive.
Words the way you word things.
That's really interesting, isn't it? It's I wish I had learned that earlier, that it's all about how you say it.
Yes.
Isn't it? So the first really, and you guys have probably heard me tell this story before, but the first really eye-opening moment for that, for me, was learning to say to owners, so I used to say to owners, do you feed your cat treats? And of course, every cat owner said no.
No.
Yes.
No. I
They say no.
No.
They automatically say
Yes.
no, right? Because you ask them a yes or no question, right? And in their head, they're trying to, like, you can almost see the wheels turning.
Am I in trouble here?
Because they feel
gonna
that
be bad?
there's a right answer and the wrong answer, so they're trying to pick the right answer,
Yeah.
right? And so
Exactly.
the majority of them would say no, I don't feed treats, and after it took me a long time, but I'm like, well, then how come there's so many treats in the market for sale?
Yeah.
Like
Right.
somebody's feeding these treats, right? And so I turned the question into, what kind of treats does your cat like? You know, Frank, our clinic cat, he really likes Brand X, and oh my gosh, now everybody feeds treats.
Of course they do. They've all been, yes, it's just how you, and I learned that. It was in human medicine when they first started teaching the med students to ask the open-ended questions. I'm like, oh, why don't we do that? We need to ask
Exactly.
open-ended questions, because I had clients say, oh no, we only eat dry food, feed dry food. And they thought that I didn't want them to feed the wet food and certain brands of the wet
Absolutely.
food. And that's
I
not
thought
true.
you wanted to hear.
Exactly.
Yes, that's exactly right.
Because they want to be a good cat owner. Mm-hmm. Yeah.
Yeah.
Well, we only have like about 5 minutes or so left, so we definitely want to at least touch on the intercat aggression problem, right? At least I find that one sometimes hard to solve. It's kind of like trying to make two roommates like each other.
Yes,
Yeah.
so cats, you can't make them like each other.
Exactly.
Either they like each other
Or they
don't. And so whenever I do a behavioral consultation, I tell caregivers, these are the goals. You want them to tolerate one another. You want them to live in the house comfortably
Without
together.
killing each other.
Yeah,
trying.
and
Yeah.
Flirting or-
and this comes back to the cat-friendly home environment, and making sure that they each have their own safe spaces. They have their own spaces since they are territorial animals. You don't want them to compete over food, litter boxes, water, shelter, places to
Hiding
rest,
places,
safe
sleeping
places. Yeah. So there need to be different ones in different places, and that's a big start.
You know, that's a good way to look at it. You're almost trying to help each one set up his own territory, right? In the,
Yes.
If you can.
Yes.
And now that's challenging in people who live in small spaces, right? I know. But that's a, you made me think now that's a good way to frame it, right?
Right,
They each need their
exactly.
territory.
Yes,
Yeah.
and those small places, when you work with people that live in smaller places, vertical space is
Vertical.
really important for cats.
Yeah.
So I have one client who, she brought in 2 feral cats from a very cold winter in Wisconsin, extremely cold winter, and she felt that they were going to die out there. And so she had 2 well-socialized cats and then these 2 feral cats. And she kept them separate for 6 months, and then her veterinarian recommended contacting me. Well, after we talked, it was a process that they had for a few months, and they were building what they called cat highways across the house, because it's those narrow spaces, the hallways, the
Yes,
stairways,
yes.
where there's blocking. And
Yes.
blocking is a sign of tension in
Yes,
cats.
yes.
Right? They block, this is my territory, you are not coming up here.
Yes.
And this is where they get them and, go after them. So instead, they have highways going through every single room in their house now, and in the hallways, and on the stairways. And they're just beautiful.
I love it.
And, you can purchase these.
You can.
There are all kinds of cat shelves.
Yeah.
There are all kinds of cat trees.
Yeah, yeah.
But they made these easily,
highways.
and with a non-slip surface on them, some cat beds on some of the perches. I'm like,
That's amazing.
it's in the. I asked if I could use that
Yeah,
in
yeah.
the 2022 AFP intercat tension guidelines.
You want to
and
take
they-
pictures of that. That's amazing.
Absolutely,
Yes.
Yeah.
and we did. So she said absolutely.
Sometimes clients are very inventive,
They are,
aren't they? Yeah.
And I have to
Yeah.
tell you, so these 4 cats, at the end of the time, she said they are all doing well together.
Yeah.
They don't love each other.
Yeah.
These 2 love each other, completely different than the first 2. And these 2 love each other.
Yeah.
And
But they
2
can
of the cats
coexist.
2 cats go high and 2 cats go low.
Yeah. So
and
they
it
kind of
stopped all the
decided.
blockings, all the tension.
Yeah.
Right? See,
Yeah.
you give the cats tools and they sorted it out.
Yes.
You
Yeah.
just need the
Yes.
tools.
Yeah.
And I learned from the caregiver,
Oh, that's crazy amazing.
Cat highways are the way to
cat
go.
highways.
It's a cheap way, inexpensive way that cats delight.
That is amazing. I always like to end on a positive note, and I have to throw in one more little anecdote. So last fall, I had the opportunity to visit Ernest Hemingway's house in the Florida
my gosh,
Keys.
you got to visit it?
I did. And so it has a big property with it, and it's full of gardens, and there's cats roaming around. And I'm walking down this like one, garden pathway, and I look over to my right, and there's a little path that leads to like a big area. I didn't go down there, so I don't know what's there. But there was 2 cats. So there's one cat in the little lane that led to this round area, and then there was a second cat who was coming from that round area. And I watched a whole conversation take place without a sound being uttered. So the orange cat slowly walked forward and set himself at the end of that little lane, right?
Yes.
And the white cat watched him, walked around a little bit, and then turned and left. So that whole conversation was, you are not going down this lane.
Exactly.
Right?
They communicate so well that people don't realize that because that's not the vocal communication usually.
I know. It was a whole story played out. So, right? They do interact. They just do it in their own way.
They sure do.
Yeah, I know.
That's wonderful.
Oh, Ilona, it's so great to have you on the podcast.
Oh, thank you. This is a pleasure.
I hope you will come back and do, because there's so much cat behavior stuff to talk about.
Oh, I'd love to.
I have so many questions. So we'll definitely have to have you back. And we're really grateful that you took some time to spend with us. So
Thank you so much. This has been a delight.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.